Hi, this is Tiffany Tula doing my final head to toe assessment for NSG 212 for the lab portion. My patient is a 37-year-old female who comes in. She's clean and well groomed. Her skin is of proper color for her ethnicity. Is tan, warm and dry with no rashes or lesions. She came in with a steady gait and is alert and oriented ×4. We have assessed her vital signs, which are all within normal limits, and I will begin my full head to toe. So upon general survey, I have inspected her general appearance as I stated before. Skin inspections of her hands and arms, warm and dry to touch with no lesions. Her cap refill is proper. There is no clubbing or edema or cyanosis at all. I'm going to palpate her radial pulse, and there's also her brachial pulse in here we can palpate. Her fingers have normal range of motion. Wrists and elbows, shoulders. Her muscle mass is nice and toned. And next I'll be moving on to her head, face, and neck. So I'm going to inspect and palpate her skull for size and symmetry. Her hair is clean, no lesions and no infestations. We'll check her face color, no lesions, symmetrical, no facial droop. Her cheeks puff out. Eyebrows, can you raise your eyebrows? Frown. Smile. These are all to check cranial nerve 2. So you can check her temporal artery. Check her salivary glands, parotid glands, submandibular. There are no lesions, no enlargements. Check for jaw, open your mouth. Checking for TMJ. There's no clicking or popping. You clench your teeth. Normal there, symmetrical. Palpate the temporal here and masseter. You push your jaw out. Open jaw. Okay. We're gonna check her sinuses. We're checking for the maxillary and frontal. I'm gonna check her lymph nodes. Occipital lymph nodes. Tonsillar, submax, post-cervical, and supraclavicular. Her neck size is symmetrical, no lesions, skin is clear. Range of motion, can you turn your neck side to side, up and down? Normal range of motion. You can shrug your shoulders. Symmetrical in movement. Your head. Assessing the patient's neck, which is symmetrical and with normal range of motion. Side to side, up and down. There's no lesions or bumps on either side. Patient's trachea is midline here, with no distension of veins on either side. Patient's carotid pulse is strong and bounding. And all lymph nodes, periocular, postocular, jugulo-digastric, submandibular, submental, occipital, anterior and posterior cervical, and supraclavicular are all unpalpable. They are not swollen. Lastly, we're going to check for tracheal deviation. You tilt your head back and swallow for me. Swallow again. Checking for thyroid. All with normal limits. So now we're going to move to the patient's eyes. If you notice, the pupils are equal, round, and reflective to light. Doing the light test. Both reactive with accommodation. The patient has equal full vision in all fields with confrontation, and according to the Snellen exam. Patient's sclera, I'll shine a light again, is white, bilaterally, with pink, light pink, conjunctiva. Patient's eyes are brown, and they're even, there's no swelling, and they are set evenly within the... We're going to move to the patient's ears. If you look, they're equal in size and placed symmetrically on the head. They're intact with the mastoid process, and there's no tenderness or lesions in the pinea or in the tragus. The patient's tympanic membranes and ear canals are normal and intact. You can see. Move to the next one. The patient has equal hearing according to a Weber test if it was performed, and a Rini test and the whisper test. Now we're going to moving on to the patient's nose, which is symmetrical. You can see the patient has no deviations in her septum. If you can inhale, exhale. There is adequate air movement throughout each nostril. And if you look inside, patient's nose is clear and good color. Testing her sinuses, is there any pain or tenderness? It's a palpation. Moving on to the patient's mouth with the light. Patient's teeth are clean and white. She has alt of her 28 adult teeth. No lesions on her, close your lips. No lesions on her lips or on her mouth. Does not wear dentures. And if you look, smile again, her gums are pink and her mucosa is normal. Patient's soft palate, open, is intact. Looks good. Let me say ah. You can see patient's tonsils are of adequate size, they're normal, and her uvula is centered. We're going to be checking the posterior thorax and lungs. Check her AV transverse ratio to make sure there's no barrel chest. We're going to check for percussing of the lungs. Check for CV tenderness. I'm also going to auscultate the lungs. On the right side, we'll be listening on all three parts of the lung. In, out, in, out, in, out, in, out, out. So patient's anterior thorax and lungs so far have no lesions or lumps felt upon palpation. You can see the skin is clear. There's equal vibrations felt during tactile fremitus. The patient's lungs are also equal with breath sounds, and chest rise and fall is observed. I'm going to now auscultate the patient's lobes. Okay. Let's go and listen to the aorta. Here. Moving on to the patient's cardiac assessment, I'll be assessing her heart sounds from moving from ape to man. S1 and S2 are noted with no murmur. Moving on to the abdominal assessment, you can see that the patient's abdomen is round and symmetrical with no scars or pulsations. I'm going to observe her bowel sounds in all 4 quadrants. Bowel sounds are present in all 4 quadrants. Now I'm going to palpate. Is there any pain?
Nope.
No pain with deep palpation. Or light palpation. All sounds were audible and going to percuss. Lastly, on the head-to-toe assessment, we're going to assess her musculoskeletal system here. You can see her feet and toes are nice and healthy. I'm going to check her strength and range of motion in her legs. Any pain?
Nope.
And check her grip strength. Both sides equal. And then there is no swelling noted on ankles or legs. And I'll check her pulses here. Both pulses are palpable. You can also check behind her knee. Pulse is palpable as well.